food animal production. All right, just some housekeeping rules, some housekeeping. Dr. Walker should have by now put in the chat a 5 or 6 question questionnaire that we'd like you to complete via SurveyMonkey. And without further ado, I'm going to ask you to complete the survey, and then towards the end of our 2-hour presentation, we will look again at the results of what your survey, and again, it talks about antimicrobial awareness. We have about 6 presentations today. I do not have the ability to mute the mics, but I will ask that everyone mutes their mics and tries to control the distractions in their background. We're gonna begin with a presentation. Well, sorry, let me just pull this up again. We have a pretty tight schedule. We're now starting at 10:10 a.m. according to my watch. And so it means that we'll end at 12:10. We do have a gap in the program between 11:10 and 11:25. And if we have Mrs. Stevenson Myrie, we will ask her to move up into that session if we're running early, or Mrs. Cynthia Graham from the Ministry of Health and Welfare, if we need to move the program along. All right, so welcome again. It's World Antimicrobial Awareness Week, and it began September 18 and it runs through to November 18 through to November 24. And it talks about spreading awareness, let us stop resistance. Very topical now. And as we all know as practitioners, whether veterinary or human medical practitioners, antimicrobials relate to antibiotics, antivirals, very topical now, antifungals, antiparasitics, broad classes of 4 drugs, 4 pharmaceuticals that we must strive to control the usage of and the disposal of the containers in which these products are. We're going to begin. Dr. Walker, can you let me know if you have by now sent the survey?
Yes, I have twice in the chat.
Twice in the chat. The start of the survey, views on prescribing. I'm going to ask you to try and do that survey for me now, please, if you haven't already done. And I'm going to run full speed ahead. We are supposed to be listening to Dr. Jose Pablo Diaz, who is our guest speaker from PAHO. And he will be looking at antimicrobial resistance and the role of the pharmacy PAHO initiatives. Now, PAHO, as we all know, has been very, very topical these days. All in all, with what's happening now with the COVID-19. And Dr. Diaz Madriz, I'm trying to go back to my high school Spanish. He is a PharmD and MSc graduate. He is an infectious disease clinical pharmacist and who has a master in pharmacology and medication management. And he's the director of the Antimicrobial Stewardship Program at Clínica Bíblica Hospital in San Jose, Costa Rica. How did I do, Doc?
Excellent.
He's an adjunct professor of pharmacology at the University of Costa Rica and at the Universidad de Ciencias Médicas. Dr. Diaz Madriz has worked as an advisor for the Ministry of Health of Costa Rica, and he's a member of the National Commission on Antimicrobial Resistance. He's one of the co-authors of Costa Rica's National Action Plan on Antimicrobial Resistance. He's also a member of the National Strategy for Surveillance of AMR, and he is an international consultant for PAHO. He has worked in workshops in Central America related to antimicrobial resistance. He has delivered several webinars on implementation and optimization of antibiotic use in Latin America, and hopefully he'll be able to advise us today here in the Caribbean. Without further ado, help me welcome Dr. Jose Pablo Diaz Madriz. Welcome, Dr.
Thank you. It's an honor to be here with you guys today. And I hope I can help a little bit with the celebration of World Antimicrobial Awareness Week. And let me know if you can see my screen. Okay,
Yes,
can you see it?
Yes.
Okay, awesome. So, first of all, I would like to talk a little bit about the initiatives that PAHO is working right now. And at the end of my presentation, I'm going to talk a little bit about the role of the pharmacy. That is a very, very important role in antimicrobial stewardship programs. So these are the topics we're talking today about. First, all the PAHO initiatives, and as I told you before, at the end, a little bit about the role of the pharmacy. So first, in July 2021, PAHO facilitated 2 workshops to present and discuss this document, the WHO policy guidance on antimicrobial stewardship activities. And the purpose was to offer a set of pragmatic, evidence-based recommendations to drive comprehensive and integrative antimicrobial stewardships. So this document has 5 pillars related to how to address the situation of antimicrobial resistance through the antimicrobial stewardship programs. So first, they recommend to establish a national coordination mechanism for antimicrobial stewardship and develop guidelines. Then ensure access and regulation to antimicrobials, improve awareness, education, and training. And the other ones are more like a complement. This document, the consultation, is available in the PAHO website. And basically with this consultation, they were able to find a lot of common problems and challenges, but also some possible solutions. So I would like to address some of them. For example, in policies, regulation, and access, the chief and support of the commitment of the authorities is very, very important in Latin America and also in the Caribbean. We don't have like all the resources, and it's not very easy, but it's very important that the authorities can help us in improving these kind of situations. We need clinical guidelines and digital resources. For example, and I'm talking about Costa Rica, that is my country. Here, we don't have a lot of clinical guidelines for almost anything, and infectious diseases is not the special one. We don't have guidelines, at least national guidelines for community-acquired pneumonia or urinary tract infection. So it's important to start having this kind of documents in our countries and in our hospitals, because as we know, antimicrobial resistance changes a lot between the countries and between hospitals. So it's important to start having this for a lot of infectious disease. Awareness and behavior change is also very important. We need to start thinking differently about antimicrobials, because we know that the general public and also the prescribers are not very worried about our situation, but we know that we have a big problem. Education and research is also very important. And PAHO is offering technical cooperation for the implementation of antimicrobial stewardship programs. And I'm going to talk about that in a couple of minutes. And they also develop a roadmap. That roadmap is going to be shared with all the countries of our region. And we're going to continue helping developing national action plans on an AMR with a focus on antimicrobial stewardship activities. Right now, there's a pilot in Ecuador, El Salvador, Guyana, and Nicaragua to start implementing this. So it's a process, but we're trying to help as much as we can. In antimicrobial consumption, this is also a very important topic. The institute that is in charge of this in the whole Latin America and the Caribbean, region is CUFAR, that is the Centro Universitario de Farmacología Argentina, that is like the University Center of Pharmacology of Argentina. And this center already helped 6 countries in Latin America, Argentina, Chile, Colombia, Costa Rica, and other countries, to establish basal antimicrobial consumption for the whole country. This is very important to know how are we using antimicrobials in our countries, not only in the country level, but also in the hospital level. So they are also working hospitals. And this is very important if your country wants to be part of this, to communicate with PAHO, to get the support. And there's also a plan on this, well, it's a survey on the purchase of antimicrobial in pharmacies, that we know that in some countries of our region, we have laws that, so the patients need a prescription to buy antimicrobials, but even with the regulation, there's not a lot of surveillance. So a lot of times patients, for example, here in Costa Rica, can buy antimicrobials without prescription in the rural areas of Costa Rica. In the support of antimicrobial stewardship programs, we are doing a lot of things right now. There's a course on the implementation and strengthening of antimicrobial stewardship programs right now in Spanish. We're working in one in English for the future. And in this topic, the next steps are to support in capacity building in Latin America and also in the Caribbean, to add new countries and publish the results. We are also doing some other projects related to antimicrobial stewardship programs, like the PPS, that is the prevalence point survey, and the baseline checklist. So in a couple of months, we're hoping to do the same with the Caribbean. Another thing is the PAHO is trying to improve communication strategies. So PAHO worked with several countries to do the implementation of their awareness campaigns with videos, mass media actions, webinars, and they also released the handbook of communication. This one is also available to try to reach more people. This is very important. Right now, for example, I don't know if it's the same in Jamaica, but for example, here in Costa Rica, a lot of people are doing campaigns related to prostate cancer through the whole month, but we are not talking a lot about antimicrobial resistance. So we need to make a shift in that. These are some examples of the work that PAHO helped. And we are also working on control the dispensing of antimicrobial in some countries like Brazil, Chile, Colombia, Cuba. This is a really slow process, but we're really trying to control this, and it's important also to work these things in the Caribbean. And to talk a little bit about the role of pharmacy. Pharmacy is very important in the antimicrobial stewardship programs. This is the definition from this document. And if you see the definition of antimicrobial stewardship program, there's a lot of things that pharmacists can help. For example, if you see right now, AMS is a thing that should be implemented across the continuum of care in the hospitals, in the community pharmacies. And this is a topic related to optimal drug regimen, drug dosing, route of administration, and duration. So pharmacists can help with this. So we're very important as a professional in these programs. For example, if you check these recommendations from PAHO, the core members of an antimicrobial stewardship programs includes a physician, a pharmacist, and a microbiologist. And it's important because right now in a lot of Latin American countries and also in the Caribbean, we don't have like the same model of pharmacists that they have, for example, in the US. So we're used to have pharmacies only in the pharmacy, and they are not considered or we are not considered as clinical pharmacists or clinical members of the team, but we can train pharmacists in our countries so they can help with this thing or this kind of programs, the antimicrobial stewardship programs. It's very important, and this is how things should work. We are very used to have hospital pharmacists in our countries that are only inside the pharmacy and don't have any contact with the physicians or with patients. But we're trying to move forward to have clinical pharmacists, to see pharmacists in the floors talking with the physicians, and in the future, having ID clinical pharmacists. So pharmacists that are clinical and are also specialized in infectious disease. So this is something that we have to aim. It's probably going to be a slow process, but it's really helpful. In the US, for example, this is the core elements of Antimicrobial Stewardship Program. And if you see, one of the main things in the US is pharmacy expertise. So they recommend to have a pharmacist as a co-leader of the stewardship program to help lead implementation efforts to improve antibiotic use. The functions of the pharmacist are very wide in this topic. For example, review the request for antimicrobials, provide feedback, detect unnecessary prescriptions, detect unnecessary prescriptions while collecting medication requests from hospital units, dose adjustments. So it's a very pharmacy thing, the management of antimicrobials. So I think it's very important to help pharmacists grow in the clinical area, but we definitely have a gap. We have to overcome this, and we are trying to develop pharmacists inside the antimicrobial stewardship programs to probably have this in a couple of years here in our region. And to finalize, I want to show you an example. This is from my hospital. In my hospital, we have an antimicrobial stewardship program that is driven by pharmacy. So we are the leaders of the program, and we published this last year in the PAHO journal. And these are the changes that we see after we implemented our antimicrobial stewardship program. I don't have a lot of time left, so I would like to talk a little bit about cefazolin. If you see here, cefazolin is, as you remember, first generation cephalosporin. And if you see here in period 1, this is before the implementation of the antimicrobial stewardship program. And if you see, our consumption in defined daily doses was very low at the beginning. And after that, we start working a lot with this medication in order for the physicians to prescribe that drug as prophylaxis for surgery. And we managed to increase the use by a very high percentage. This is not the same with all drugs. For example, with ertapenem, in my hospital, we're using a lot of ertapenem, and even with an antimicrobial stewardship program, we haven't have a real impact. This even increased, but they are using it a little better right now. To talk more about that example of what happened with cefazolin, this is a report that we presented in United Week this year. And so in my hospital, we're a hospital without restriction on antimicrobial prescriptions. So basically, any physician can prescribe whatever they want. And we have to talk a lot with them and try to teach them how to prescribe some things that we are worried. And as you can see, again, in this study, we saw that after a 5-year intervention, we managed to have an increase of almost 60% in optimal selection of antimicrobials in surgical prophylaxis. We also managed to increase the optimal duration. That this means using less antibiotics. And we also reduced the consumption of ceftriaxone that was like the preferred agent for surgical prophylaxis in my hospital, and we know that this is a third generation cephalosporin and has a lot of impact in the antimicrobial resistance, and we increase cefazolin a lot. We also detected some improvements in over these 5 years. For example, in bacterial resistance, we decreased in 11% of E. coli with how do you say that? Expanded spectrum beta-lactamase, and we didn't have any issues with more surgical side infections or any adverse drug reactions. And this is how it looks in the graphic of consumption. If you see it, this one is cefazolin, and this one is ceftriaxone, and this is the consumption in the whole hospital. And if you see over the years, we managed to increase the consumption of cefazolin, basically talking with each surgical specialty. For example, we start with gynecologists, and then orthopedics, anesthesiology, even with intern medicine physicians. And progressively, we saw an increase on the compliance with our clinical guidelines of prophylaxis. So this is a very basic example, but as we can see, we can have a real impact. And this is important because, for example, in a lot of Latin American countries, this is from a study that is going to be published very soon. If you see here, almost 40% of surgical prophylaxis are antibiotics that are considered that should be reserved for other infections. For example, this is a lot of 3G cephalosporins. We're using like 40% in countries like Cuba, Paraguay, El Salvador, Mexico, and Peru. So probably we can do a study like this or an intervention like this in our countries to see an improvement in surgical prophylaxis and then see results in our antimicrobial resistance. And that is a little example, but we are also working in the ICU. We're working in the internal medicine wards to try to increase awareness and also optimize the prescription of antimicrobials in my hospital. And that's what I wanted to share today. If you want to contact us, this is our emails, and I will be glad to answer any questions.
Okay, Doctor. I thank you very much because you have actually shared a lot with us, especially, and I like the story of the Stewardship Program. I found it interesting that you spoke about doctors being able to write a prescription for anything and everything. And it's because of that, you in your country, and especially in your hospital, you had to have the ASP, the Antimicrobial Stewardship Program. Can you tell me though, with the CEPH, especially with the cephalosporin class, that's antibiotics, have you seen a similar need for stewardship program with their antifungals, such as ketoconazole, miconazoles, and so on? Have you looked at those at all?
Yes. Actually, we did a little research about that, and we're using also a lot of antifungal drugs. Sometimes they are more like, well, the thing is that the diagnosis of fungal disease is also a challenge because sometimes you have a patient that looks like they can probably have a fungal infection. You need to start the drug right away, but sometimes they do it just in case something happened, and that is the problem. We have to optimize that too. But yes, definitely we have like a problem with that. My hospital is a private hospital, so we only work with infectious disease physicians and ICU physicians, but they also need some training in that because, as I told you before, sometimes they use it like, we call it like a cooking recipe. All the patients receive the same just because they are here in the ICU, and sometimes they don't need the drug. But yes, definitely we need to improve the work or the prescription also on antifungal drugs.
Without hogging anybody's question, I do know for me, if it looks like a duck, smells like a duck, sounds like a duck, then we're going to do that same cookie cutter treatment of an antifungal and antibiotic and so on. For instance, with ear infections, which is going to be a combination of lots of microbes, a nice soup. Let me skip to the chat to see if there are any questions there for you, Doctor. We have a little wiggle room, 2 minutes. Let me look to see if there are any questions in here. No questions for the good doctor. All right, Doctor, I am going to say muchas gracias. Thank you very much. Thank you very much for your presentation. And you will be sticking around with us, I think, for the next hour and a half, yes?
I will be here until 10 a.m. After that, I have another meeting, so I have to change, but I will be here. If you have any question, I will be checking the chat, and feel free to ask me whatever you want.
And could you, in the chat again, please, Doctor, put your email, your contact, so if anyone would like to ask you a question directly, they can do so via the chat, or at least copy your email and your contact. Thank you very much again, Doctor.
You're welcome.
Have an awesome day and enjoy the rest of the time that you're with us. Okay. Well, what's the weather like in Costa Rica now?
It's very nice. It's very nice right now. Yeah.
Okay.
Yeah, it's very nice.
One day when COVID is done, whenever that is, I shall be.
Right now we are in a good place. Cases are dropping. We have a good vaccination rate, but probably we're going to have another wave around February or something like that because of the Christmas and New Year. It's going to be complicated to manage the meetings and all that kind of things. But right now we're in a pretty good shape.
Thank you very much, Doctor. Okay.
Bye.
All right. So everyone, we're back again. We have an exciting group of panelists. We have my colleagues, Dr. Kevin Walker, Dr. Kirk Harris. I have Mrs. Cynthia Graham. Hi, Mrs. Graham. I have some drugs I need registered. Mrs. Ramona Stevenson Myrie, who is from Good Life Pharmacy. I hope to be doing some business with you, Mrs. Myrie. And we have Miss Calethea Wellington. I haven't met you yet, Calethea, but we have spoken. I am Dr. McNabb, who used to be at Caribbean Broilers Nutramix. Yay! All right, so our panelists, I'm going to run quickly through who they are, what they represent to us here for this week, for this next hour and a half. And the topic that we'll be looking at is the role of agencies, prescribers, pharmacists, and suppliers in limiting antimicrobial resistance through the stewardship. And this is a stewardship program similar to what Dr. Jose Pablo Diaz spoke about earlier. We have Dr. Kevin Walker, who is my good friend, life of the party guy. I'm not doing the official bio, Kevin. I know he has a first degree somewhere. We went to vet school in the same place somewhere. He's a graduate of the University of the West Indies somewhere in Trinidad. And like Dr. Kirk Harris, Kirk, I hope you forgive me. I'm not going to do the official bios for both of you. You're both my very good friends. Kirk Harris is on the opposite end of the spectrum of Kevin, who is the life of the party. Dr. Kirk Harris is a veterinarian with the Jamaica Broilers Group. He's a Christian man. He's a funny guy. Funny guy. In school, we called him Palm Tree because of his height. He's over 6'3". Then we have, let me be the official welcome now for these people. Mrs. Ramona Stevenson Myrie is a registered pharmacist since 2016. And after obtaining her Bachelor of Pharmacy degree from the University of Technology, she spent 3 years at Hospital up in Montego Bay. she decided to shift focus to community pharmacy, which is a very responsible field. Ramona, you look very familiar, actually. Very, very, very. Did I teach you? I think I taught you.
Yes, you did, Dr. McNabb. You did.
I know that I'm seeing your face. So yes, as veterinarians, we do cross over into the human pharmacy field. We do teach as well. We teach a program called Veterinary Pharmacy, but I'm not here to talk about me. Ramona she has her own establishment, Good Life Pharmacy, since October 21 in the height of the pandemic, and she strives to live up to the tagline, good health for a good life, which includes the animal wealth and health welfare. She makes an impact in the delivery of pharmaceutical care through personalized and meaningful interactions with our patients. Then we have Mrs. Calethea Ann Wellington Hemmings. She is the pharmacist at Newport Mills Limited. Is that you with the red hair? That's you? You need blue and yellow because Nutrimix colors are blue and yellow.
Yeah, that's me with the red hair.
Yeah, you need blue and yellow for Nutrimix.
Oh boy, that would be exciting. I had yellow the other day, so maybe the blue will be around shortly.
I don't mind the red hair. She has an honors degree in pharmacy from the University of Technology, and she's also a registered pharmacist. Calethea is responsible for ensuring that we do not have any antimicrobial resistance developing in the animals that she serves through Nutrimix, which is part of the CB group of companies. And I guess, Kevin, should I really read anything of it? Doctors Kevin and Dr. Harris, my good friends, welcome all. So how will this panel discussion run? We're going to have each person make a presentation, beginning with Dr. Walker for 15 minutes. Then Mrs. Graham. Is Mrs. Graham on? Mrs. Cynthia Graham? Yes, I'm seeing her. Ramona Stevenson. Good morning, Mrs. Graham. I need to share your bio. I know you are head of pharmaceutical and regulations at the Ministry of Health and Wellness. And you are the person who helps people like myself to be responsible in the drugs that we register here. You need to show your face. Yes. Hi, Mrs. Cynthia Graham. Welcome, welcome, welcome. And I don't want to continue chatting because I will everybody's time. So without further ado, Dr. Walker, over to you.
Thank you, Dr. McNabb, for that warm and lively welcome and greeting. Let me see if I can share my screen. Hold on a second. Okay, can everybody hear me and see the screen clearly for me to begin?
Yes, we can. You just have to put it on view,
screen sharing.
View mode. Yeah.
All right. We're all set. Right. Good morning, everyone. Thanks for joining us. I am, like Dr. McNabb said, Dr. Kevin Walker from Veterinary Service Division. I'll be doing a little bit on the regulation and competent part of prescribing. All right, we here at the VSD are guided mainly by the OIE, which is the World Organization for Animal Health. And over time, themselves, WHO, FAO have come up with some guidelines as I see antimicrobial resistance as being an issue going forward as we are getting more incidents of AMR, as it's commonly called. All right, so they have pushed for responsible and prudent use of antimicrobial agents in veterinary medicine. That's what the OIE has done. Prudent use in veterinary medicine will not only protect animal health, but by extension, human health and environmental health, because we all know about the One Health concept, which is something that is pushed because we're all interconnected. All right. responsibility, which is one of the things that they focus on. Remember, the responsibility for prescribing is not only the competent authority, but all the stakeholders. So the veterinarians, the medical doctors, the pharmacists, the feed manufacturers, the veterinary pharmaceutical industry, food animal producers, regular farmers, groups like that need to be responsible for, prescribing medication the correct way. All right. So the aim is really to control antimicrobial use in food production. Oh, I just got a note that my slides are not moving.
Kevin,
is that correct?
Kevin, put it on viewer mode. It's still on.
Okay. The first slide. Okay.
Yeah, it's still there. Put it on the viewer mode.
All right, hold on 1 second.
Yeah. That's full screen mode. There you go.
Yes, slides are moving now.
Moving, but we're still seeing.
Yeah, I don't think when you put on the slide mode, it doesn't seem
move. The other one.
Doing that. Let me try that.
The next one.
Oh. No, I put it on the other one before. It wasn't.
Okay. All right.
Is it moving now or no?
Try again. No.
No, I might have to leave it on other mode.
Yes, try that.
Yeah, I might have to use it in this mode. All right, and like I was saying, sorry about that the responsibility falls with everybody involved in food animal production at all different levels. All right, one of the next things is prudent use, right? So the agents, animals, as part of good veterinary practice and good agricultural practice, commonly known as GAP, which is something that was made up by the FAO, which highlights different methods of managing the farm, from biosecurity to using certain things to keep the animals protected, like vaccines, good husbandry practices. Those are some of the things that we can maintain so they don't have to be using antibiotics. As you know, I showed the image there of pigs and looking very comfortable in their environment. It looks clean, easy access to food and water, so you can limit the contamination and issues of having bacterial challenges that might need to be using antimicrobials. All right, and the coordination should not only be at a national level, because of our global connection, it should be at a regional level as well to help protect and cause for prudent use. All right, you must also implement practical measures and recommendations needed to improve the animal's health and welfare, some of the stuff that I just highlighted in GAP, right? And you must do proper selection so that it can minimize the emergence and the spread of antimicrobial resistance in animals and humans. So using the correct drugs for the correct pathogens. All right, so rational use of antimicrobial agents in animals with thinking about the efficacy and safety, complying with the ethical obligation and your economic need for animal health. One of the things that I found in going to some of these global conferences is that here, because antibiotics are so expensive, because we do not really produce antimicrobials here at that large scale. A lot of the other countries in Asia, some of the South American countries that do produce antimicrobials do use them a lot more in their feeds and in their production as a regular routine, because it's at a minimal cost to them. It's very small for cost in their inputs in animal production. So they use it a lot more, which does contribute to resistance. Luckily here, we can't afford it, so we're not doing that. So we minimize the issues of antimicrobial resistance. So it's up to the person that prescribed to be very wise in how they prescribe antimicrobials to animals. Right, so, and this helps to prevent the resistant microorganisms within animal populations and the environment. All right. All right, contributing to the maintenance of efficacy and usefulness of antimicrobial agents in animal and human medicine. Luckily, we use a lot of oxytetracycline, which is not used as much in human medicine. I have a graph later that will show that, so that helps. Ensuring the safety of food of animal origin with respect to residues, which protect consumers' health. So being responsible, you can, with withdrawal times, you can minimize residues, which need to be surveilled for, so that you're not passing on residues to humans that eat meat. All right, I'm going to talk about some of the roles of the competent authority, which here is Vet Service Division. There's also some regulator authority that falls under Ministry of Health, since they're the competent authority for the registration of all drugs that are used in Jamaica. All right, so we evaluate the quality and safety and the efficacy of veterinary medical products before they come into the market. Mainly the ones that we look at the ones that go into the feed manufacturers, because that's used at a large scale in animal populations, right? So that's some of the stuff that we have to do. We should be free of commercial, financial, and political pressure that might influence us approving certain medications that might enter the country. So that's one of the things that they highlighted for the competent authority. We must ensure that we do our due diligence before a drug gets market authorization. Quality control of the antimicrobial agents, make sure that the manufacturers are maintaining good manufacturing practices, GMPs, whenever they're producing these vet medical products. We must do assessment of the therapeutic efficacy of drugs. So we should be doing preclinical trials, clinical trials, and assessments after. Fortunately, we don't have the resources for that here. So most of the time we're accepting drugs that are approved by the EU and other competent authorities that have been able to do these trials. We do look at the data and use that to assess whether, yes, this drug should be registered and allowed to be used in Jamaica, right? And assessment of potential antimicrobial agents to select for resistance. So use products that don't increase the incidence of resistance. It's always a tug of war, right? We also should be involved in establishment of acceptable daily intake, maximum residue limits, withdrawal periods, especially in food producing animals, which normally we follow what's recommended by the manufacturer, since we don't have the technology to be doing these research assessments by ourselves. We also have to be involved in the protection of the environment, which involves looking at how drugs are being disposed of, if they expire, if there's an issue with them, as well as the residues, the waste from animal production, to ensure that they're disposed of properly. So we always have to do an assessment based on how the drug will impact the environment. All right, establishment of summary of the product characteristics for vet medical products, the active ingredients, the target species, the therapeutic indications, the operator safety, the dosage regime, and the route of administration. These are some of the things that a competent authority must be involved in based on the OIE, right? We must be doing post-market access antimicrobial surveillance, which we can do by looking at surveillance and doing studies to see how much resistance is there. All right. We must be involved in the supply and administration of vet medical products containing certain antimicrobial agents, ensuring that it's being prescribed by a vet, by a licensed professional, if that is the case of it being an antimicrobial agent, not by anyone that has no training or knows how to use the vet medical product. We must control advertising as a competent authority. And this now with social media has become a real issue, because you have a lot of persons getting their hands on vet medical products and advertising them through social media for use in different areas that the drug was not prescribed for. So that has become something that the competent authority is trying to get more involved in right? Training on usage of antimicrobial agents. So you must ensure that, vet schools are training new graduates as well as agricultural schools on how to use antimicrobial agents. You also need training on how to store it properly to ensure that it keeps its efficacy, and record keeping to ensure that you know when it's going to expire, when you have to use it by, when it was used, when it's supposed to be withdrawn, things like that. Very important. And there should be a lot of research, both public and industry funding, but because there are limited resources, sometimes that does not happen as it should. Right? Some of the things that competent authorities should be involved in. This slide is not showing very clearly. I don't know if you guys can see my pointer. This is part of the data that's collected. Oops, there. The data that's collected over the past couple of years that I submit to the OIE on the usage of antimicrobials in the veterinary field in Jamaica. Mainly I focus on the large food producing operations and the main suppliers of these vet medical products. The middle one, I'm trying to see if I can get my pointer to show it, but it's not cooperating with me. I don't know if you guys can see it now, but this box that's highlighted here, this is the Americas. And the blue here is therapeutic use, and the pink is for growth promotion, right? What happens at OIE collects this data from 160 countries around the world, and they group them in areas. This is the Americas, and it shows that we here in the Americas use antimicrobials a lot for growth promotion. This bar chart here is Europe, where they actually have a lot of restrictions on that. So most of their antimicrobial use is therapeutic, very, very thin line for growth promotion. If I go down on the slide, the drug of choice for growth promotion, which is this one that's extended here on the bar chart, is actually bacitracin. That's what's used mainly as growth promotion worldwide. So it's something we have to work on. We've just started to track the data. This data is probably from 2015, so it's not a lot of years as yet, just a few years, but it does give us an idea of what's going on in the world and in our region. All right, the OIE does talk about the responsibility for the pharmaceutical industry and the responsibility of wholesalers and retailers as well. We don't have a big pharmaceutical industry here that manufactures vet medical products. There are some companies that do some repackaging and stuff like that. So we do have to monitor that, as well as the wholesalers and retailers, which, some of the responsibilities involved, ensuring that, the data, the supply, the expiration date, the batch number, a copy of a prescription when you're distributing these products, ensure that it's going into the right hands. So these are some other things. These can be expanded, but I won't talk a lot about those today. I'll talk about some of the responsibilities of veterinarians, which... Go ahead. I didn't hear that.
2 minutes.
2 minutes. All right. Yeah, I'm almost done. So with a veterinarian, your main focus is to promote public health, and animal welfare. So identifying, preventing, and treatment of animal disease, which must be done with your training, not just blindly treating. So only use antimicrobial agents only when they're necessary. You must use diagnostics and clinical experience to guide you when treating, not just giving broad spectrum for everything that can create selective pressure to get more resistant antimicrobials out there. Appropriate use of the drugs, the dosage, the withdrawal time, especially in food animals. Make sure that you're keeping proper records, right? So the data is there so you can know if you're having issues with a certain antibiotics when using in food animals. Labeling, especially because a lot of times we leave drugs with persons. If it's a powder form or liquid form that's going in the drinking water for a large flock of animals, sure that's labeled so that people know what drug it is, when it can be stopped before slaughter, stuff like that. And training and continued professional development, which is one of the forums here. So you can know what's going on out there and keep abreast. All right. Other responsibilities fall on food producers, especially the big animals, to ensure that they're being guided by a veterinarian when doing large-scale food production operations. So antimicrobials are not abused. Same thing with the feed manufacturers, that they're being guided by the veterinarian and knowledge out there of drugs and how they should be used, especially in medicated feeds, and to make sure the feeds are stored properly so there's no mixing, stuff like that, certain precautions, batch numbers and codes. Right? I just have this one last slide here to talk about stewardship, which, as you can see, nearly half of stewardship involves prescribing and being proper use of vet medical products. That's how important it is to ensure that you're using it properly. All right, that's pretty much it. Thank you all for your attention. And I turn it back over to you, Dr. Matt, now. Dr. Matt, now.
Thank you. Thank you very much, Dr. Walker. Funny that you're ending on the scapegoat, because veterinary medicine is oftentimes seen as the scapegoat, I sometimes believe, when it comes on to the stewardship program for antimicrobial usage. I am going to very quickly dare say that Cynthia Graham is a friend of mine. She has helped me out in many instances when I worked in corporate. And Mrs. Graham is no stranger, I believe, to most people on this panel, certainly those in Jamaica. She is well placed as a director of Standards and Regulations Division in the Ministry of Health and Wellness to be sitting on this panel, because we're talking about stewardship, Antimicrobial Stewardship Program. Mrs. Graham has formulated, she's part of the formulation and implementation personnel who have implemented and formulated norms and standards for establishing and maintaining those microbials that are used here in Jamaica. Dr. Walker did speak about the veterinary pharmaceuticals as well as the human medical products that are used. And Mrs. Graham is going to be talking to us now also on the topic of the stewardship program, prescribing and usage of veterinary and human medical. And I don't know if somewhere, panelists, if you can also talk to us, or maybe when we open up the floor for questions, to look at the alternative medicines, the nutraceuticals, the yeast products that are out there. So Mrs. Graham, without further ado, welcome again. And I hope you had a good Sabbath this weekend.
Thank you. Good morning, everyone. All protocols observed. I'll just go straight into the presentation. So I'm going to just share my screen at this point. Are we able to see my screen?
Yes, we are. Are you going to
let me put it into slideshow and hope it works. All right. As was indicated earlier, I'm the Director of Standards and Regulations in the Ministry of Health. The Standards and Regulations Division is the National Drug Regulatory Authority administering the Food and Drugs Act and Regulation, which oversees the regulation of all pharmaceutical products that are used in country. And so is about, do a brief outline of the antimicrobial products registration process, brief description of the antimicrobial products and the way forward. So WHO in their publication, Effective Drug Regulation, multi-country study, have given us a basic definition of what medicines regulation is all about. It is a totality of all measures legal, administrative, and technical. And this is which governs governments take to ensure that the safety, efficacy, and quality of medicine, as well as the relevance and accuracy of product information, is what we have on our market. Now, we regulate to ensure quality, safety, and efficacy of medicinal products in order to assure the continued protection of public health. So the Ministry of Health and Wellness is the entity responsible for the protection of public health. And we need to bear in mind that no medicinal product is completely safe or efficacious in all circumstances. But there is a moral as well as legal expectation that appropriate steps are taken to assure optimal quality, safety, and efficacy by the producers concerned. So the manufacturers, their local attendants, their local representatives are legally responsible, and we have an expectation of them that they are going to be ensuring that they take steps to assure the quality, safety, and efficacy of the products that they submit for consideration for placing on our markets. So the main reasons we regulate medicines, which include, of course, our antimicrobials, is to prevent irrational consumption and prescription. So we are looking at the whole idea of rational prescribing, rational use, rational dispensing of medications as we look at antimicrobial stewardship. We want to be able to prevent substandard, falsified, harmful, useless products from getting to our market. We also want to prevent shortages of needed medicines or delayed access, and we also want to prevent increased cost of medicines. And so those are the main reasons why governments regulate pharmaceuticals, medicines. Now, the Drug Regulatory Authority, which is the Standards and Regulations Division in the Ministry of Health, is a network that administers a full spectrum of drug regulatory activities. And these activities are wide and broad and requires a lot of resources to be able to carry through. So we do marketing authorization for new products, and we do variation for existing products on the market. We are supported by a quality control laboratory, which is a government chemist lab, as well as the CARFA drug testing lab. And we do monitoring of adverse drug reaction as well. Critical for our functions to go forward, we have to ensure good manufacturing practice inspections and licensing of manufacturers, wholesalers, and distribution channels. And I say we in collaboration with the Pharmacy Council, because the Pharmacy Council administers the Pharmacy Act and regulation, and they are responsible for regulating the places and the persons. We are responsible for regulating the products. We ensure that we carry out enforcement operations, which means that we need to inspect, we need to monitor, and we need to take action to ensure that the standards are being upheld. We control the promotion and advertisements in regulation, and we monitor the effectiveness of the systems that we have in place by doing surveys, drug utilization reviews, and point prevalence studies, and so on. So Dr. McNabb had indicated what the 4 categories of antimicrobials are. There are antibiotics, antibacterials, antivirals, antiparasitic agents, and antifungals. And we have recognized that antimicrobials have enabled medical advancement over several decades, and antimicrobial medicines have substantially reduced mortality from infectious disease and have provided protection against infectious complications from many modern medical practices, including surgery, neonatal care, and cancer treatment. So when we look at, for example, upon prevalence studies that we would have conducted at some of our hospitals, we'll realize that one of the outcomes is that the medical ward is using more antimicrobials than we are seeing surgical patients using. And so we recognize that antimicrobials, without them, you'll find that some of those critical surgeries that need to be done would probably have to be postponed if we don't have appropriate antimicrobials available to manage any kinds of surgical infections. Then prevent surgical infections. And then we also have antibiotics, recognizing that the antibiotics are the most powerful weapons for the treatment of many infectious diseases, and those are the ones that are caused by bacteria. And we're mentioning antibiotics because that's mainly the focus for me today. So WHO has indicated that antimicrobials is a fragile market with limited regulatory control. And they have estimated that more than half of all medicines are inappropriately prescribed, dispensed, or sold for antibiotics. this trend could be much higher. And so if we're talking about more than half of the medicines inappropriately prescribed and antibiotics are being, the trend is higher, then we can understand the inappropriate use of antibiotics that we have to look at as we look at as antimicrobial stewardship. Simultaneously, as we see where antibiotics are being inappropriately used and prescribed in certain jurisdictions, in other jurisdictions, sustainable access to quality antibiotics remain a problem, and leaves people either untreated or treated with suboptimal antibiotics. So it's not an equal spread, it's not an even spread. Access in some countries is very, very limited, and we can understand that this would be our low income and middle income countries that would be having these kinds of concerns or problems as it relates to accessing antimicrobials. Now, AMR is a global public and individual health challenge affecting the delivery of safe, effective healthcare in all settings in all countries. And we have come to understand that AMR leads to increased mortality rates and duration and cost of patient care. So this is something that is a major concern. It's something that we need to see how it is that we can work together, a multi-sectoral approach to be able to contain as we look at what is happening on the Jamaican market. This is a slide to show us a report that the Center for Disease Control Prevention produced. This was their reporting that more than 50 million unnecessary antibiotic prescriptions are written each year for patients outside of hospital. And when we look at the slide in terms of the purple box are those that are the percentage that are unnecessary, and the blue box are all the prescriptions that have been prescribed. And when we look at this, we're talking about community prescription, not in hospital, use in community pharmacies and so on. And so we need to recognize that we have a major work to do also in terms of introducing antibiotic stewardship in that area of practice. So as we look at antibiotic stewardship and optimizing care using antimicrobials, we have to focus definitely on rational use of medicines. And the definition that was coined at the WHO organization conference of experts on rational use of medicine is that rational use of drugs require that patients receive medicines appropriate to their clinical needs in doses that meet their own individual requirements for an adequate period of time and at the lowest cost to them and their community. And the same applies to all antimicrobials, the appropriate dose for the right bug and the appropriate quantity and at a reasonable cost. So now we're going to look a little bit at the legislative framework that supports how it is that the National Drug Regulatory Authority operates. And the two bits of legislation that supports our activities are the Food and Drugs Act and Regulation and the Pharmacy Act and the regulation administered by the Pharmacy Council of Jamaica and the agency of the Ministry of Health and Wellness. And in the Food and Drugs Act, we have a definition of what a drug is, and it's any substance or mixture of substance manufactured, sold, or presented for use in the diagnosis, treatment, mitigation, or prevention of a disease, disorder, abnormal physical state, or symptoms thereof in man or animal, restoring, correcting, or modifying organic functions in man or animal, and it includes disinfection in premises in which food is manufactured, prepared, preserved, packaged, or stored for sale or sold for the control of vermins or insects in such premises. And so this definition definitely encompasses all that antimicrobials are, and hence as they are classified as drugs, they are regulated as drugs and regulated under the Food and Drugs Act. Now, for all of the drugs that are used on our market, they are regulated through a registration system. And the Food and Drug Act Regulation 65 says that a person shall not import, sell, advertise for sale, or manufacture a new drug unless he has been issued a license by the minister in respect of those activities. And he goes on to say that he should pay a fee, and the fee there is indicating $5,000. So we're basically saying that this fee is not prohibitive for persons to be able to, at this time, submit their products for registration and go through the regulatory process to have their products assessed for market. And any person who desires to have the license for their products will definitely have to submit an application to the minister. And in terms of the minister's representative, as we said before, is the National Drug Regulatory Authority, the Standards and Regulations Division. No, the products go through a product registration process, which is a passive process, but it involves scientific review of documentation that's submitted by the client. However, product samples are actually assessed at the drug regulatory laboratory, so that the claims that are made regarding the product can be validated through that drug testing. We also want to indicate that in the process, the client prepares a dossier, submits to the scientific officer in the division, and then the product goes through detailed technical assessment, and then it is presented to the product registration committee. And if it is a veterinary product, it is assessed by the veterinary subcommittee, and the report from that committee goes to the product registration committee. Then the experts in the committee, which constitute all our scientific professionals, we have our medical doctors, we have representatives from the veterinary services. We have the director of veterinary public health in the Ministry of Health. At one point, we used to have a representative from the veterinary services on the committee, and we would really want to have that individual back on the committee as well, because it is critical that we have that input from your agency. Then the other aspect of it is that once the committee assesses, they can accept, approve, and classify and give a license for the product. They can request additional information, they can defer the registration, or they can refuse the registration, depending on what is presented as it relates to the efficacy, safety, and quality of the product. I'm not going to go through all of this in the interest of time, but as it relates to the quality of product, of course, the manufacturer has to show purity, conformity with assessment, good manufacturing practice standards, product stability. As it relates to the efficacy, show that the clinical claims are supported through clinical studies. And if it is that it's a generic product, through bioequivalent studies. If it's a new moiety, through bioavailability studies. We look at the pharmacological and the therapeutic activities as we assess the efficacy. And safety, we're looking at the risk-benefit profile. We're assessing the toxicity of the product, the toxicological report. We're looking at the side effect profile, and we are looking at its use in special population. So those are some of the things that we look at in terms of the committee assessing the product. Also required for products for registration or consideration for license for market is that most of the products that we use in Jamaica are imported products, and so they are manufactured in other jurisdictions. So we have a reliance mechanism on organizations our counterparts in the other countries, the national drug regulatory authorities there, and they provide us with their findings as it relates to the assessment of those products, which is also used as we assess the dossier that is presented before us. So they present to us a certificate of pharmaceutical product, and they also assess the manufacturing plant and present to us a good manufacturing practice certificate for the facility in that country. And those are used in some of the registration of the product in Jamaica. Another jurisdiction, and it is refused registration in Jamaica because of our own situations in Jamaica. It may be that we don't have a need for that antimicrobial, we don't have the organism is not something that we are concerned about in Jamaica at this point, and so we can defer the registration until when it's absolutely necessary. You don't want to introduce a drug where it's possible that the use of it may lead to abuse and lead to antimicrobial resistance. So we classify the products based on the Food and Drugs Act and regulation as well. And all antimicrobial oral and IV preparations are classified as prescription drugs. Some of the topical preparations that are very old in terms of the moiety are classified as over-the-counter preparations recommended by a pharmacist. But most of the other topical preparations are classified as prescription drugs as well. Dispensing of antimicrobials, they are only supposed to be dispensed from a pharmacy, a registered facility with the Pharmacy Council, and under the supervision of a pharmacist. A pharmacist is responsible for dispensing list 4 drugs, and a list 4 drug can only be prescribed by a medical doctor, a veterinary surgeon, a veterinary practitioner, or a registered dentist. And that's what the law says at this time. Of course, we are working to amend the law, but right now, our pharmacists will only dispense antimicrobial preparations based on prescriptions from those practitioners. As it relates to the veterinary preparations, of course, the veterinary preparations will be classified as list 4 products as well. and they have to be labeled accordingly with the words for veterinary use on the labels. And for antimicrobial preparations that are for veterinary use, there are other requirements, as was indicated earlier in the presentation, that as it comes to what we call food. Oh, sorry. when it comes on to lactating cattle and all those kind of things, what we have is that as long as they're going to be on antimicrobials, that there is always a time that is allowed for the drug to elapse, a time that has to be elapsed for the drug to be worn out of the organism, out of the animal, so that you don't have the residues of the drugs in meat. And if residues of the drugs are found in meat, and persons consume those meats, and the evidence have been shown that persons have developed, we have seen antimicrobial resistance being developed from consumption of meat kind with residual antimicrobials. We do post-marketing surveillance, as was mentioned before, where we do the assessment of the products in terms of its quality after it is registered, whether or not there are any kind of adverse events, whether or not the product is failing in its efficacy. We do those post-marketing surveillance, and of course, laboratory testings are conducted. We regulate the manufacturing of antimicrobial products locally. We do have 2 or 3 manufacturers of antimicrobial products locally, and they have to meet the good manufacturing practice standards established in the Food and Drugs Act. Post-registration activities we mentioned earlier, we do pharmacovigilance, and we do product promotion and advertisement. So when it comes on to product promotion and advertisement, list 4 preparations are not supposed to be advertised to the general public. However, we do allow for promotional materials to be shared with healthcare professionals, and these promotional materials are assessed to ensure that they are truthful. The statements about the effectiveness, contraindications, and side effects are truthful. The information is balanced. The instruction for use is correct, and it is that the material is indicated for the approved use in country. Just to say that there are policies that governs prescribing and dispensing in the public sector facilities, and these include the list of vital, essential, and necessary drugs and medical sundries. That's the VEN list for short. And in the VEN list, we have products classified in different areas for specialist use and restricted use. And the products that are for specialist and restricted use requires a consultant signature, and in most cases requires that culture and sensitivity test be conducted prior to the administering of an antimicrobial to that patient. We also have a level of use and type of facility. So we have our hospitals, our primary care facilities. So depending on the type of the hospital, whether it's a type A, B, or C, or the primary care facility, different products are assigned for use in those facilities. Prescribing is guided by treatment guidelines. So we have currently our HIV, malaria, and TB treatment guidelines. And the prescribing and dispensing is guided by the pharmacy department policy and procedure manual. We mentioned the monitoring using point prevalence survey. I don't have to go into that in details. That was spoken to already. Just to mention that one was conducted in 2018 at the University Hospital of the West Indies. And it was noted that the 7 top preparations that were prescribed at the University Hospital of the West Indies on screen, ceftriaxone being number 1, metronidazole being number 2. As it relates to the parenteral antibiotics, the percentage of antibiotics prescribed, there we see it again, ceftriaxone, metronidazole, number 1 and 2 in terms of the order of the highest. At the conclusion of the point prevalence study, the researchers recognized that there was a heavy use of broad spectrum agents, particularly cephalosporins, that metronidazole is used over prescribed on the basis of other combination therapies. That combination therapy is excessively used. A snapshot, high antibiotic prevalence use, 40% of patients reviewed are on antibiotics, and there's a widespread use of cephalosporin and quinolones. We did national survey looking at a wide basket of drugs, but it also included antimicrobials in 2010. And from that, we recognize that antibiotic usage, it was noted, was prescribed one to every 3 patients. And injectables, in terms of antibiotics, 1 in every 12 patients. The guidance documents that we spoke to earlier, the treatment guidelines and the VEN list, when we looked at the availability of them in the facilities to guide the treatment, we will see where the standard treatment guidelines were only available in 46.4% of the facilities and the VEN list in 35.7%. The survey showed that prescribing medicines, selling of prescribed medicine without prescription does not seem to be a widespread practice, and I'm happy to say that we find that our pharmacists are really strict when it comes down to their antibiotics and dispensing. But we know that we are seeing some antibiotics out on the open streets where persons are selling. So we need to do some work where that is concerned to find out what is the source and to be able to manage that. And then just to say that drug utilization evaluation and drug utilization review is another modality that we use to monitor the systems to see whether or not they are being adhered to. And coming out of some of those activities and actions that we have had to take as a regulatory authority, we have a postponement of registration and introduction to the market of new antimicrobials where the microbiological trends do not support their use presently. We mentioned collaboration between clinical pharmacists. These are specialists in infectious disease or pharmacists trained in antimicrobial stewardship, and prescribing physician to prescribe antibiotics only when indicated. We have refused registration of or cessation of use of antibiotics used in humans, in animals that form part of the human food chain, for example, penicillin in poultry and cattle. And we have had a refusal of registration of irrationally fixed dose combination of antimicrobial agents. Some of the gaps, we recognize that the legislative framework is inadequate. We need additional updated treatment guidelines to guide the prescribing. Basic standards of clinical best practice with regards to managing AMR for healthcare professionals are needed. Environmental standards, including the correct disposal of antimicrobials, are needed. We have weak monitoring and enforcement mechanisms in place, and the regulation of community antimicrobial prescribing, dispensing, use, monitoring need to be strengthened. And of course, we have resource constraints. The way forward is for an assessment of all the national AMR relevant regulations to be conducted so that we know what our situation is truly. And then we create a specific AMR law and all health approach where we have a multi-sectoral collaboration, and all of the relevant entities will be party to and will be carrying out their roles and responsibilities under that AMR law. We need to review and strengthen current regulations and policies on prescribing and dispensing, implement antibiotic stewardship programs, establish a regular evaluation program for antimicrobial use, ensure an effective enforcement framework, develop policy for antimicrobial waste disposal. We need to conduct restructuring exercise for the National Regulatory Authority. We need to look at the authority, and we need to look whether or not we need to join authorities together from different agencies so that we have that one health approach as we manage antimicrobial resistance. And we need to have continuous regulatory reform as we move forward. Thank you. Over.
Thank you, Mrs. Graham. Ladies and gentlemen, we have just about 2 minutes just for you to stretch a little bit. We will take the questions from Mrs. Graham and Dr. Walker and all the panelists at the end of the presentations. So just take a 2-minute stretch. Mrs. Graham, thank you ever so much for that. That's right. That's a good stretch. You deserve it, Mrs. Graham. You deserve it. Very comprehensive. And we did hear from our regulators from the Ministry of Health and Wellness and from the Veterinary Services Division. So I'm seeing 2 questions in the Q&A. Dr. Walker, let me have you take the first question. Somebody's requesting a certificate of participation. Have CE credits been applied for to the relevant bodies, the Pharmacy Council, if it is that, and the veterinary regulators? Is there a certificate of participation or CE?
I'll check with Oh. I'll answer in the chat.
Okay. And then Mrs. Graham did allude to it earlier, and this is a question from Casey Shorter. She's asking about the drugs that are running rampant on the streets without a prescription. And we all know about the red and black pill. I didn't even know it still existed.
Yes.
I didn't know it still existed. And I do know that the pharmacists are very judicious about filling prescriptions. I tell this story all the time. When I first started practicing, wow, almost 20 years ago, wrote a prescription for doxycycline, and the pharmacist called me on 2 counts. A, was I sure about the dosage, because it was 5 doxycycline once a day for 14 days. And secondly, my registration number, she called it into question, is 125. So almost 20 years ago, I guess not many veterinarians were writing prescriptions to the human pharmacy. And for doxycycline, where we use it at 10 mg, well, we use it at whatever dosage we use it for. So your pharmacist, Mrs. Graham, you can be proud, are very good at ensuring that the prescriptions are appropriately filled and judiciously managed and monitored too. And without further ado, let me hasten to introduce a former student of mine. We look the same age. Everybody better say yes. Ramona. Ramona is the owner and operator of Good Life Pharmacy. So I'm not going to take up your time, Ramona. Welcome. And it's good to see you. See, I remember you. Over to you, Ramona.
All right, so today I'm going to just be touching briefly on the role of the pharmacist and how we can really promote antimicrobial stewardship. I'm going to share my screen. Just give me a moment.
Can you check IT? Somebody's mic is open.
Can you see my screen?
Yes, we can.
All right, so we've already covered what exactly antimicrobial stewardship is, so I won't go over that. I'll just go right into how pharmacists can really make an impact in the issue that we're having. And the main ways are by collaboration with other healthcare professionals and the other healthcare sectors, by educating the public at large and the specific patients that come to you, and through monitoring and follow-up after dispensing, which I think is probably the most important part. In the hospital setting, I used to work at Hospitin, which is a small private hospital in Montego Bay. And some of the things that we had there was an in-house formulary. So we would decide based on lab results which antibiotics to use. And if we had started empirical therapy, then after the lab results came back, we would make a switch depending on what was the specific drug for use. And then it was also important to switch from IV to PO as quickly as possible, just to help patients to have less side effects and to tolerate antibiotics better. As I said before, the follow-up of cultures and to suggest the change in therapy if it was necessary, and to work with the doctors to ensure that the dosage of the drug, the duration, and the time of administration and the parts of the nurses was strictly adhered to, just to prevent overdosing or underdosing in that case. In the hospital setting, I think it's a little bit easier to manage because you have patients right there. They're being watched and monitored on a continuous basis. More problems come about when we look at the community setting, and so we have to focus on educating the patients and ensuring that when they leave the pharmacy, they are using the antibiotics or antimicrobials as they should. And so we want to promote the use of culture identification before we prescribe antibiotics. I know it's probably going to be a little bit difficult because as Jamaicans in our culture, we get sick, we go to the doctor, we expect to get our antibiotics right away. And I find that a lot of patients, if they don't get antibiotics, they feel as though they have not been treated properly. They expect to go to the doctor and leave with a prescription for antibiotics. And so that's kind of part of the mindset that we have to change, especially since most common colds and flus are not adequate or not treated by antibiotics at all. So we have to change that mindset among Jamaicans that we need antibiotics for everything. It's also important to have open dialogue with our prescribers, ensure that the prescribers in your area know that they can reach out to you for advice on medications and antibiotics specifically to prescribe for certain conditions, what is available in the area. And also the practice of using shorter therapies where possible. Usually we have this rule where we prescribe antibiotics for a week to 10 days, but studies are showing now that 3-day therapy is just as effective in certain conditions. For example, UTIs, it showed that 3-day therapy is just as effective as a 7 to 10-day therapy in the treatment. And a 3-day therapy is better because it increases compliance. Patients will not reach to 3, 4, 5 days and forget to finish taking the medication because they feel better. And it reduces the incidence of resistance as the pathogens will then have a less exposure to the antibiotics. We also want to try and encourage non-drug therapies where appropriate, again, using the case of a common cold or flu. Rest, hydration, and vitamin supplementation, is usually all that's needed to get rid of a cold or flu. We don't need to throw antibiotics at everything. And again, it goes back to changing the mindset that we need medication for everything. A lot of patients don't understand that the cold or the flu that they have is caused by a virus, which cannot be treated by antibiotics. And all you're doing is causing more harm than good. So we also want to talk about infection prevention with our patients. Now that we are experiencing this pandemic, there has been a focus on hand washing and sanitization, and I think that that's something that we need to continue even after, just to ensure that this trend of infection prevention continues. And as I said before, to change the mindset that the antibiotics are always necessary. As pharmacists, we're a lot of times the first point of contact and need to use the opportunity to educate our patients and to let them know that there are other opportunities or other treatments available. And in the case where antibiotics are prescribed, we need to educate them on the proper use of antibiotics, let them know the correct time to take it, how to take it, whether it's with or after a meal, how it interacts with their foods, how it interacts with alcohol, and how it interacts with other medication. In terms of side effects, we need to let them know what to expect and how to respond to these side effects, whether or not they should discontinue the medication or speak to their primary care physicians. And then finally, in how to dispose of unused medication. Usually I encourage patients that if they don't finish their medication, they should return them to the pharmacy. However, if that's not possible, it can be mixed with an uncollectible substance like coffee grounds and put in a seal bag in the trash just to avoid it getting into the water supply. It's never encouraged that you flush medication or throw them down the sink for that same reason. And then in terms of monitoring and follow-up, we want to ensure that our patients are actually taking their medication. So something I've started doing is I call patients about halfway into their therapy just to ensure that they're still taking the medication, to see if they're having any side effects, to see how they're feeling, if they're feeling better. And I find that it's something that's really appreciated because they feel as though they are getting a full personalized care then, so to speak, and they're able to, or they're reminded that it's the therapy that they should continue. In moving forward, I think it's important to have ongoing education in forums such as this, just to continue to remind us of the importance and to help us to keep up to date with the latest evidence-based antibiotic prescribing, and to continue to encourage a shift in the mindset of our patients that antibiotics are not always necessary, and of course, to increase collaboration with our labs and to encourage our doctors to actually test samples before prescribing antibiotics, or to prescribe empirically and then prescribe more specifically once the samples are back. And here's a little meme that I found on the internet, which is a conversation I have a lot with patients who say they always need antibiotics for their colds. And you have to remind them, not as severely as this shows, but you have to remind them that their cold or flu is caused from a virus and cannot actually be treated with antibiotics. And that is it from me. Back to you, Dr. McNabb.
Thank you very much, Ms. Stevenson. Dr. McLennan Miguel, I'm seeing your hand, but somebody's mic is open and it was very noisy on this side. Ms. Stevenson, I'm very happy you put up that slide, that closing slide about using an antibiotic for the common cold, because it is true. We need an antibiotic for every single thing. We need an antibiotic because your eye is itching you. You need an antibiotic because you have the sniffles. We need an antibiotic because of the COVID. Very well done, Ms. Stevenson, very well. You must have had an awesome teachers. But very good, and congratulations and all the best in Good Life Pharmacy life.
Thank you, I appreciate it, thank you.
Again, we're going to reserve the questions, but I'm seeing a couple of questions coming in from veterinary colleagues in particular about veterinary pharmaceuticals, but we're going to take those questions at the end. So we have heard from a private practitioner in the pharmacy world. We're now going to hop over now to the animal world, where we'll be speaking with two of our primary producers, livestock feed producers. We're going to be speaking with Dr. Dr. Kurt Michael Harris. And then we will close off the panel session speaking with Miss Red Hair, Miss Calethea Wellington from the Bigger Better Feed Producing Company, Nutramix. So Dr. Kurt Michael Harris, over to you. Then we'll have Calethea. Then we will open the floor where we will address the questions posed. Thank you, Doc.
Hi, good morning, everyone. How are you doing? Hi, Dr. McNabb.
Hi, Dr. McNabb. Is everybody hearing me?
Yes, we are.
Thank you, guys. It's such an honor and a privilege to be among such esteemed colleagues. There's something that you had wanted to ask about. You had mentioned earlier regarding the nutraceuticals and probiotics. I'm going to address that briefly for you so that we can have at least some information regarding that. Unfortunately, guys, my computer had a little issue today where it actually had a crashing. So I'm going to have to try and freelance through my presentation. I'm very, very, very sorry. I must ask you to bear with me, okay? So just going to in a short time, Dr. McNabb, you said I'm 6'3". I think I'm actually 6'7" the last time I checked. And on a matter of keeping things light, Dr. Young, hi, Dr. Gabby, and Dr. McNabb, we had our lecturer in serial genealogy, Dr. Gustav, you remember Gustav, and he made a joke of me. So one day we were actually doing PDs, pregnancy testing in cows. So we're there, and I think Gabby was doing her thing. And so he looks up at me, Dr. Gustav, the suave one, and he says, "Oh, Dr. Harris," because I was actually doing a test myself. And he gives out, "How are those tonsils feeling?" And everybody, of course, was rolling on the ground because, I'm that tall and my arms are long. So he's saying that I've bypassed all of the reproductive structures and intestines and stomach and all the way up in the tonsils of the cow. So that's just to break the ice. All right. So I want to understand the connection of, the antibiotics and its use in food animals. And in particular, as Dr. McNabb stated, in feeds, we will have recognized in recent times that both primary feed manufacturers in the island have stated that their feeds do not have any antibiotics in the general makeup of it. And that is trying in an attempt to basically align ourselves with the international standards, especially those standards which are in Europe. And because of that, we as veterinarians have to ensure that the farmers that we have to deal with on a daily basis, particularly those who are raising poultry, which we know is over 80% of the protein which is consumed in Jamaica. We have our pig farmers, we have those who raise cattle, those who do goats and so on. So we have to ensure that we try to advise them on best practices. So this is where animal husbandry and preventative medicine comes into play. We have to be on the ball with it. We have a lot of farmers who are very stubborn. They want to do things their own way. We have gone to farms. I'm sure even Dr. Patrick Craig, who is online as well, we've gone to some farms that, boy, we really get to bringle more than any dog that we see. When we see the conditions that they have the animals underneath are trying to say that they're growing the animals and then they expect another outcome based on what they're doing. When we see that, trust me, it is nowhere near the acceptable standard. So we know that antibiotics are strong medications, and I must congratulate all our presenters thus far. You have done an awesome job. And it's just like, just summarizing and everybody doing this whole collaborative effort. And we really are, working together to see that we can edify one another, bring up a memory, and just enhance what we have to do going forward so that we can do the best that we can do for our farmers and patients and clients in general. So there are strong medications that are designed to kill bacteria, that is bactericidal, and bacteriostatic, which stops their growth. Sometimes the antibiotics themselves can be harmful. So we know that some antibiotics are actually, some animals and people as well can have allergic reactions to antibiotics. My father, I found out, was allergic to sulfonamide when he had conjunctivitis or pink eye. And he took some of these antibiotics and he came out of the room and I was wondering which Chinaman this was, because his face was all swollen up. We had to rush him back to the hospital to get him sorted out. So some antibiotics can actually be harmful. So people, and we are the ones who administer antibiotics to animals as well. They don't go and take it up. So it is misused and also overused and underused, right? And it can lead to the growth and spread of, bacteria that are resistant. And it can lead to infections that cannot be treated. Animals have bacteria in their intestines. A little known fact that many people do not realize is that if we were to calculate the amount of bacteria on our inside, even more so even on our skin, it is actually more bacteria than that makes up the entire gamut of our bodies, our cells and epithelial cells and all of that. We actually have more bacteria in us than that construct in us than what constructs our body. Okay, so we have to realize that antibiotic resistant bacteria can spread from animals to, yes, they can spread from animals to other animals in the same location. It's logical. It can be spread from animals, animal products, such as, your chicken, for those who like their T-bone steak and so on. And that comes from the fact that probably we have these meats and that we are looking to consume to prepare, and it's not prepared properly. When I go to the States and somebody asks me, sir, how will you have your steak? I said, I like it burnt. And they laugh and say, oh, you're Jamaican. I say, most certainly, Jamaica land we love. Burn that beef right down to the core. Amen? Amen. So we want also to realize that antibiotic-resistant bacteria can be spread through produce such as fruits and vegetables and through contaminated water or the soil itself. The environment to animal fecal matter. So prepared food to unclean surfaces. We want our surfaces to be clean such as the cutting boards that we use, the utensils, the vegetables, all of that. We want to ensure that we have our meals or what we're going to use for the meals and so on prepared in as session as call us coming. It can affect us in certain ways. And it can be done by food that we eat that is infected with antibiotic resistant bacteria or microbes. We have to ensure that our hands are clean. When the hands must be clean, we talk about being as sanitary and as sanitized as possible. We are not to touch unclean surfaces, and we have to ensure that we use the approved sanitary agents. So bacterial infections that are resistant to antibiotics can lead to in some cases, mild illnesses or some clinical presentations. And we can see that a lot in our livestock production. And that is where we observe people being very experiencing different levels of inefficiency, different levels of production, and they wonder why the animals are not doing well. And it can be the case that they are dealing with some clinical infections which are caused by antibiotic resistant bacteria, right? So the illnesses can range from mild to severe and can even lead to death in animals where there is a great multiplication, release of toxins, and so on and so forth. When you talk about our post-mortem thing, we'll talk to our great Dr. Craig, who is our veterinary pathologist extraordinaire, and he has a wealth of knowledge on these things. So the Food and Drug Administration of America, and I think a lot of our regulations actually are intertwined and interrelated, talk about the misuse of and control of antibiotics in people and animals. So animals raised for food, there are approved antibiotics that should be used, and they should only be used to treat animals that are sick. We've often seen persons, and I know that my colleagues can relate, to people who say that they just want antibiotics to give to the animals just in case, as in when a pig has just given birth to piglets, or the goats or the cow have the kids or calf, or the lambs in the case of Dr. Young, our sheep specialist. So, you know, people want to just use these antibiotics willy-nilly, and that we are well aware will lead to antibiotic resistance to the further problems down the line. We want to use the antibiotics also in controlling illness in a group of animals where some animals are sick. So we want to have them isolated and to treat them specifically so that there will not be an extended spread throughout the herd. We also want to prevent illness in the group of animals that are at risk of becoming ill. I'm coming down quickly. You're not hearing me properly? Everybody hear me? Hold on, let me just adjust something here.
We're hearing you, Doc.
Oh, you hear me? Somebody said they were not hearing me. Okay, thank you for that. All right, so we also want to ensure that antibiotics are recommended by, thank you, Jordan, recommended to be used in animals raised for food and consumption only when absolutely necessary, and also to preserve the animal's health. So even now we see that, you know, many persons, as was mentioned before, in certain locales are used to promote to promote growth of the animals. We have basically moved away from that. So the doctors are really treating animals that are not well and that are in need of that assistance for that specific treatment. Our regulator also spoke about the fact that we want to treat animals with two specific diseases that are the antibiotics that we want to prescribe or administer will have the most efficacious activity. In other words, we do cell culturing of the bacteria, and then we do panels to ensure that they are which antibiotic, be it your fluoroquinolone, be it your penicillin, your tetracycline, or so on, which ones the bacteria in question are resistant to, or they're susceptible to, so that we can have the best treatment possible. All right, so in closing, Dr. McNabb, see, I told her I'm going to be short, not like my height. Our former pharmacist at HIPRO, Mrs. Vanessa Chatry, has been marketing products which are nutraceutical in nature, specifically some that have garlic-based products and echinacea. So one we have here, I should have a demonstration. I don't know if you're going to see. One is called Gravitol. I'm sorry, it's not showing properly. So one is Gravitol, and Gravitol is used as basically to treat diarrheas and so on. We have one called Coxasan, which is used in treatment of coccidiosis, as the first part of the item suggests, coccidiosis in goats, in poultry in particular. And one of the products that everybody would have realized, Dr. McNabb, I'm sure you would have used it in your practice in treatment of especially one of our greatest enemies, not screwworm, but parvoviral infections. There is Salmonax, which is a yeast-based probiotic, which is used in they say it increases weight gain, because what it does, it actually displaces those bacteria that are not really beneficial in the intestine, those bad bodies, if you want to call it that, and promote basically the good bacteria to really proliferate. It also produces a rapid growth rate. It strengthens the immune system. It is used for in heat stress applications. And, you know, I've used it myself. Yes, my colleague. I was on the road one day and I had a little bit of a Usain Bolt / Asafa Powell issue, or Elaine Thompson, and we won't really go too much into that. But you know, I like to give a little joke here and there. And I took a teaspoon of the Salmonax, and lo and behold, I could have carried myself through the day without relieving myself in the nearby bushes. So it really works, I can tell you that. And if Dr. if Dr. Moto is online, he will also attest to the fact that Salmonax does work. So colleagues, I really want to thank you for hearing me out. We really have to be judicious in our prescription of these antibiotics that we have to use with our farmers. I know that I have an awesome responsibility, being one of the persons on the ground in the pharmacy era of HIPRO, and I know that I'm accountable. I'm very accountable, and you guys will call me up and draw me up to ensure that I am doing a good job, and I thank you for that. Thank you to the Jamaica Veterinary Board and the association, who has had many meetings with us to ensure that we do what is right by our pharmacists. So our farmers and the animals that we have to treat. So thank you again, colleagues, and thank you, Dr. McNabb, and let us continue to do the best that we can for our farmers and animals in general. God bless you all.
God bless you also too, Doctor. Thank you. We're just going to run straight into Calithia Wellington, and then we'll take our questions and so on. So welcome, Miss Red Hair. Remember, blue and yellow. Not hearing you. Not hearing you.
Yeah, just allow me to share my screen. Excellent. So good day, everyone. It is definitely a pleasure to be here, a part of this panel today. And we're looking at the role of pharmacists in limiting antimicrobial resistance through our stewardship. And just some quick objectives to determine what is AMR, how does AMR affect agriculture, who is a pharmacist, and what is the role that we play in as stewards to antimicrobial resistance. So of course, we've gone through all the scientific details about what antimicrobial resistance is. But what we want to highlight is the fact that antimicrobial resistance is a global health threat. It affects many countries, primarily developing countries, where there is little to no regulation regarding antibiotic use. It is the cause of death for many individuals globally, and it also affects people, animals, and food security, which is very important for me and my team at Nutramix, because, you know, CB is very big on food production, livestock production. So that is very important for us. We have to ensure that we control antimicrobial resistance in this area. So how does it affect agriculture? Now, this diagram is just explaining how, it shows or depicts the circle of life, and it basically explains how it is that humans are able to become, come in contact with microbes that are now superbugs through livestock, through our plants, through soil, through water. And it is one whole cycle. And so if we allow everything to escape by not properly administering medication in the right doses, ensuring that we maintain the withdrawal periods and so on, then we're just going to continue the cycle and creating all these superbugs, which we do not want, right? Antimicrobial resistance can be faced at each phase of this chart. And this is something that we want to try to downregulate as much as possible. So who is a pharmacist? Pharmacists are drug specialists, and we are gatekeepers for drugs. So as Ms. Cynthia Graham would have indicated, there is so much that goes into the regulation of drugs, the dispensing, the various regulatory bodies that monitor and help to guide how we dispense medication. And antibiotics are, it's not any different when it comes to antibiotics. We have to be certain that when we are dispensing medication, primarily antibiotics in this case, we ensure that persons are aware of how to take it, what time to take it, if it's to be taken on an empty stomach, etc., etc. And in the case of animals, because they can't speak, when we are administering medication to them, we need to ensure that we are dosing correctly. A lot of antibiotics come in water-soluble presentations, and that can also affect how it is administered. So if persons are not cognizant of what they're doing, they can underdose or overdose their animals. And if they are not aware of the withdrawal periods associated with these medications, then that can also become an issue, because once they are slaughtered, we consume it as humans. If there is milk or eggs that are produced from these animals, we can also consume those products. Right? A pharmacist is also an educator, and this is very important in our field or in the veterinary pharmacy field, because we come in contact with a lot of farmers daily who are not fully aware of how antibiotics or how medications on a whole should be administered. And this creates a problem, because if they are not following the guidelines of the drug, if they're using drugs inappropriately, it can create a whole lot of issues down the line. And this is what we're trying to alleviate. We're also members of a team of individuals. So we've alluded to this, or other panelists might have alluded to this on more than one occasion throughout this presentation. This is not an individual drive. There's no one person or one group of persons who are trained that can combat this issue. This is something that we need to work with as a team in order to ensure that we get the optimal result that we're looking for. I work with an excellent team at Nutramix, and they help us to guide not only internal farmers or internal units, but also farmers locally who they visit and educate, in their good practices and so on. So this is what a pharmacist does, and I am a part of this wonderful team that helps to educate our country's farmers about what is right and what they need to do. Now, in terms of stewardship, pharmacists need to adhere to prescribing, to the rules of prescribing. This is very important. prescriptions for antibiotics should only come from veterinary physician, registered veterinary physicians. That is very important. There is a difference in terms of, if for some medication, in terms of dosing for animals, if you're to compare it to humans, there is a difference and a distinction in how it is administered and so on. But as veterinary pharmacists, that is something that we're more aware of, and we can relay or confer with our vets to ensure that what they're prescribing is actually what should be given based on the species and so on. One of the areas that we can help is definitely through education, as I mentioned before. Vaccination is very, very important in our field because we want to prevent any infections from taking place before they actually do take place. And so we want to vaccinate against the various pathogens to prevent any outbreak of diseases in the long run, right? This is very important primarily for those units that are doing large volumes of livestock, birds, and so on, because it is in those areas that you find you have the most antimicrobial resistance taking place. I mentioned withdrawal period earlier in terms of just allowing that period to pass before animals are slaughtered or before milk and eggs are consumed, and also good husbandry practices. This includes the proper disinfection of your animal houses. It includes using a bath or foot bath station at the entrance and exit of your animal house to prevent pathogens from getting inside these houses. It includes good hand washing practices as well. There are some microbes that are actually zoonotic, so they can pass from both humans to animals and vice versa. So we want to ensure that we eliminate or try to reduce that type of occurrence from taking place. Some are, right, what I, oops. That ended before I ended, but what I'd like to mention as well is that pharmacists are trained in the preparation and dispensation of medical drugs. And there are a number of specialties that we have not even begun to tap into as it relates to what pharmacists can do. Globally, there are various specialties, including antimicrobial pharmacists, pharmacists acting in regulatory services, veterinary services, and education, which are all important. And I'd also like to add that globally, there are different management systems that are being put in place to help to reduce or eliminate as much as possible antimicrobial resistance. In Canada, there is a veterinary client-patient relationship that is implemented, and this just ensures that there is a relationship that is had between the veterinarians and livestock producers, and this ensures that they are aware of what is happening with the animals. They are familiar with each situation, and so they can knowledgeably prescribe antimicrobials where it is appropriate, right? Without just prescribing ad hoc, basically. All right. Thank you very much. Short and sweet.
Sweet, equally short and sweet as the tall man presentation. Thank you, Mrs. Wellington. Okay, Dr. Walker, I don't know if you're ready for us with sharing the results of the survey. Are they in? If not, yes, no? Not yet? Not yet. Okay, so very quickly to summarize, I thank every single one of the panelists who presented today, Dr. Walker and Mrs. Graham, from the regulatory side of antimicrobial awareness and the stewardship program. And then on the flip side, we looked at 3 different personalities, 3 different uses of pharmaceuticals, veterinary pharmaceuticals, from the large producers, Jamaica Broilers and Nutrimix through Caribbean Broilers Group. And then we also looked at a private practitioner who is fondly called the community pharmacist, who all have a role to play in terms of the judicious use of antimicrobials. Now, I'm going to ask the panelists to open their mics and whoever wishes to take this very important question, because Mrs. Ramona Stevenson-Myrie spoke about coffee grounds and the disposal of antimicrobials, and I suspect this is more for home. So a question was asked in the chat: how do we dispose of unused or expired antimicrobials, in particular the antibiotics, but all antimicrobials? Any of the panelists wishing to open this or to answer this question? And we're talking about human antimicrobials as well as veterinary microbials. How do we dispose of expired? How do we dispose of unused?
Dr. McNabb, I'll just share with you the protocol that we have for disposal of antimicrobials, and we have two mechanisms. The first choice is incineration. So antimicrobials should be exposed to incineration at an approved entity. A service provider is approved to be able to do that activity. Other than that, and we're having major challenges now with most of our clients indicating to us that incineration is a difficult activity for them to identify with, even though we point them in some directions. But the other option is to do encapsulation. So what can happen with encapsulation is that the service provider is supposed to obtain a receptacle. So most likely it is going to be an iron drum or something of that nature, and then they are supposed to be encapsulating the antimicrobials in cement in that receptacle. And so under the circumstances, it would have been a mix. They would have to mix the product into the cement, and then they would have to seal both ends of the drum with a certain thickness of the cement to ensure that you don't get seepage over time. So those are the two recommendations from the Ministry of Health Standards and Regulations that we have been providing with the service provider with regards to disposal of antimicrobials. Over.
Who are some of these service providers, Mrs. Graham?
I don't have that information right now. I'd have to ask my team in the Pharmaceutical and Regulatory Affairs department, but I can provide you with information shortly.
And therefore, over to our veterinary people. I have a big pig farm. How do I dispose of my empty vaccine bottles? How do I dispose of the unused antimicrobials that I have there? And I have live vaccines and I have kill vaccines. How do I dispose of these, or how do you dispose of these in your facilities?
Well, here at PSD, we do have a working incinerator. So I'm sure if you write to the director with a request, he will be able to accommodate. I know a lot of the private clinicians, though, they have contracted with one of the medical waste disposal companies to do their sharps and their unused antibiotics and stuff like that. Before we continue, though, Dr. McNabb, just a quick thing. Some persons had asked about CE credits. I'm asking, I'll put my email in the chat. So just email me your name and your registration number, and I will apply to the vet board to start out the credits for them. That includes any other medical professionals that need the CE credits. I did write down the names of the vets that I saw engaged, but maybe for the pharmacists and anybody else that needs it. All right, I hope that answered your question about the disposal. There are a lot of questions there to do with registration of drugs that I think, I don't know if you saw, for Ms. Graham. And Ms. Graham, I am the VSD person for vet medical products. So whenever your committee is meeting, I will more than make myself available for these drugs to be registered, because we're in a very bad way with vet pharmaceuticals at the moment. When I was at Jamaica Broilers, I used to put in a lot of requests that I didn't get anywhere with. So I would like to, get things moving there. Definitely.
Let me just answer you. I was basically talking to my team just now, so I didn't get the first part. I don't know if you want to repeat it for me, so that I know exactly what I'm answering to. Because we have a system in the Standards and Regulations Division where veterinary services products are routed through the veterinary subcommittee. It does not wait in line for assessment any at all as it relates to the submission and the evaluation, because the products are disposed of in reasonable time by the veterinary subcommittee. So under the circumstances, when persons would have indicated to me that there are delays, I have always have had serious words with my team. Basically, what obtains is as they receive the submissions are supposed to be routed to the veterinary subcommittee, chaired by our veterinary public health specialist, Dr. Peters. And Dr. Peters would be the one that would be calling the vet subcommittee meeting, and the team would assess those products. And once you've completed your assessment and you route your responses, which would have been the recommendations after you have done your assessment, back to the product registration committee, it is disposed of in short order. So I'm gonna have to look into what you're saying seriously, because if there are delays, I need to do a root cause analysis to find out what exactly is causing those delays, because there really should not be any delays with the registration of those products.
Mrs. Graham, let me jump in here, because two of the questions that came up, and this is a long-standing issue, is can veterinary pharmaceuticals be registered under the generic preparation? So instead of, for instance, fenbendazole, which is a antiparasitic, intestinal parasitic drug, it goes by fenbendazole, it goes by fenben, it goes by Panacure, it goes by all these different names. And so the question was asked, can a product be registered under the generic preparation instead of under brand names? And then the second question that relates to veterinary pharmaceuticals all the time, the volume of products that are used is minuscule. So when you write to a Pfizer or a Boehringer, they're going to say you're not even going to use 5 cases of this product for the year, even though we think it's a large volume. And so for them to prepare a dossier to send to us to use for maybe 200 bottles of 100 mils of vaccine, it becomes difficult for them. So a part of and I'm speaking because it's what I have experienced over the years, it's difficult for them to give to us a dossier, which is hundreds of pages, for a product that you're only going to use maybe 200 bottles for the entire year or year and a half. And so the question that is always asked, time immemorial, from before I registered in vet school, why can't, if it's used in another Commonwealth country, for instance, Canada, why can't we do a similar, I don't know what the term would be used here, but if it's used there, why can't we accept it for use here? Again, primarily because of the volumes that we use here. So those are the two questions.
Okay, so I'll take the last question first, as it relates to the use of the preparations or the registration of the preparations that are going to be used in small amounts. The Food and Drug Act makes provision for products of that nature. The Food and Drugs Act allows for products that are required for the management of a condition that are not registered to be imported under section. We have section 73 and we also have section 40. Section 40 of the Food and Drugs Regulation speaks to the fact that the minister can waive the registration requirements for a particular product. So once a submission is made regarding the product, and we would ask for basic things from you. So we would want to get from you your product label. We would want a certificate of analysis on the product. We would want some information regarding the manufacturing facility, the GMP status of the facility. We would need a product brochure or product monograph. would ask some basic information, and then that product would be approved by the minister as an exemption from registration. The product can come to market. But outside of that, as it relates to your products that you have always requested veterinary products with that for which you of course have low usage, we have never ever refused to give a special permit. What we have been doing is documenting all of the special permits for veterinary products, and over time, once we realize that there's continuous use for it, then we move to we have implemented a system in the division now where we are looking at giving special registration for the products. The product would have come to market, you'd have been using it for a while, so therefore you would have been doing quote unquote a kind of research, a kind of pilot with the preparation. And so once you would have used the preparation and you can vouch for the safety and the efficacy and the quality preparation, we can go ahead and give it a special registration under those circumstances. So there are mechanisms by which these products can be registered for market without us having to get that full millions of pages dossier from the manufacturer. So just have the conversation with the team, and I'm sure they will be telling you the same thing that I told you, because it's not only known to me. The product registration is a Pharmaceutical and Regulatory Affairs branch, and they have all this information that they can share with all of their clients. So outside of you speaking to them, what you can do is you can submit your documentation to them through me. So you can submit the documentation to my office, and then I can route it back to them so that they can do the registration.
Just to be clear, Mrs. Graham, I look after 1,000 heads of pigs, and I know I use 30 bottles of vaccine A. I can submit to you through your division or vice versa the vaccine label. You're listening, CB, you're listening, Hypro, the vaccine label, the drug monograph, which will come with the vaccine anyway, how much we believe we will use per year, and finally, how we have been using it, because I did experience that with you.
And can you tell me whether or not you'll be able to get evidence of approval in the country of origin? So let's say it's Canada that you referred to just now.
Right.
I'm not sure. I wouldn't ask you to go and get a CPP. What I would want you to do is to find out whether or not you can access that information on the Health Canada website. Because they do put up publish information as it relates to the products that they have approved. And so if that evidence can be had that the product is approved in Canada or approved in the US, US normally does their letters and they put it on the website that can be printed down. Once those are made available to us, then we can go ahead and allow for the product to be given special registration for entry.
For clarity, can you just remind me of the two? What's the organization in Canada or the website in Canada?
Canada is Health Canada.
Mm-hmm.
And the United States would have been the U.S. Food and Drugs Authority.
Okay. I have a quick question for Ms. Graham. Is it possible after you can email me the members of this subcommittee? Because there's no VSD rep on it. Because it would have been myself.
You would have been aware of it, yes. Okay.
Yeah, so to kind of speak, because the vets are very frustrated because we don't have a lot of products available at the moment. And because there is a two-part thing involved, you register the drugs, and if the persons are bringing it in, customs will not allow them in without a vet permit. So I do get the permits here for me to actually have a whole bunch of them on my desk.
Could you repeat that for me, Dr. Walker? Customs is not allowing
what
them.
What happens is that customs won't release the veterinary drugs unless they get a permit from our quarantine unit here. Along with your registration.
That's not the approach that customs is supposed to be using. The permit
because of how Asakuda is as well.
It's set up,
and it is come up as a veterinary product. I mean, we don't have an issue issuing the permits. So,
yeah, we know.
They will not release it until that.
We had a system in place. We had a system in place where we said we wanted to hear from you. We needed to see you saying that it is okay for this applicant to be able to access this product. Because once you register the product, the regulation and the monitoring of the product resides with your organization. And so once you would have said to us, this applicant can have this product by issuing your permit, then the Ministry of Health Standards and Regulation issues the legal permit, because it is the Food and Drugs Act that issues the permit for the importation of all pharmaceuticals.
Right. Well, I don't think we need to. This has been going on for the 14 years I've been back practicing veterinary medicine.
Okay.
All right, and it needs to be, because of the shortages with drugs. It's a real desperate situation now.
Okay, all right.
So it would be really good. I have come to the ministry and I can name all the health ministers I've sat with to discuss this issue over the years.
Okay, Dr. Walker. I'm happy that we're having this conversation now, because we have been having discussions internally and making arrangements to see how it is that we can meet with all of our stakeholders within the first month of 2022. And so what we will do is we will definitely arrange for this meeting and for continued collaboration and working together moving forward. And as you have said, we will send you the invitation for our product registration committee meeting. I will provide you with the names of the persons who are on the vet subcommittee. That information I have to get from Dr. Peters as well. And then we will move forward collaborating and see how it is that we can have some meetings and some discussions at least once per quarter until we get, all the regulations that we need in place, so we can collaborate even more. So that's where I want to see us going. It's very important that, because you're the experts in your area. We are basically just carrying out a function based on the Food and Drugs Act. So we can work around that and see how we can do it together. And it is important for us, because what we find happening is that there have been numerous complaints about the sale of prescription veterinary products in farm stores, I think, something of that nature, that we need to investigate. So we can have some discussions surrounding that. Thank you.
Thank you very much.
There was another question that you had asked about the registration of products using the generic name. Yes. What obtains is that we could move to make that a policy in terms of a government of Jamaica, but right now the product names are actually what the manufacturer indicates as their manufacturer's brand name, based whether it's a generic or it's a new moiety. It gets the manufacturer's brand name, and then just below that, then the generic moiety is named. But we have been having the discussion in-house, because in public sector, when we look at health medication, in the VEN list, the vital, essential, unnecessary list of drugs, it's only generic, and the doctors in public sector are told to prescribe using generic names. So that is something that we probably need to look at as we look in future, as we look at continuous improvement, to see whether or not this is something that we can actually implement to register the products in the generic names, and then the brand name is, because right now, even in my system, even in my drug database, I'm having a challenge with identifying internally, for example, all the paracetamol products, or all the the erythromycin products. It's just the brand names that and I have to know the brand names to know which product it is. So that's something that we're definitely going to be looking at. But as it is now, in terms of the legislative requirements and the policies, it's the name that the manufacturer gives to the product that is the registration product name.
Okay. Thank you very much, Mrs. Graham. I see a question or a hand raised from Kalithia.
Yes. All right. So I have had to interact with the Ministry of Health very frequently to request permits. Products that have been previously registered, usually we're able to use the online platform to apply for the permits. And usually within a few days, maybe by 5 days, working days, we're able to get our permits once it is a registered product. Now, the online system has been down for months now. And when we submit a manual permit, it takes now 2 to 3 weeks, sometimes even longer, for us to get the permit back. Is there any way that this can be addressed to assist us, faster?
May I just ask you, what information did the team share with you regarding the online system being down? To the best of my knowledge, the online system is not down fully. There are some entities that when they apply online, and because of course the online system facilitates electronic payment. When they pay online, they are not able to see their payment and their receipt, and therefore that prevents them from moving forward with the online process. Is that what you're experiencing?
That is part of what we're experiencing, yes.
All right. Because we're having the conversation with eGov. Of course, they are the owner of the system. And they are moving with alacrity to fix it. However, because we are supposed to be moving to JSwift, maybe somewhere in January, February, they are hesitant in terms of overhauling the entire system. So the entities that they have been able to correct the situation with little challenges, they have actually corrected for. So if yours have not been corrected as yet, it simply means that the situation was more grave than for others. But I'll note it, and I'll have my team indicate what is happening with your complaint regarding the situation. I am concerned over when you tell me that when you submit your permits, your manual permits, it takes 2 to 3 weeks. My team up to recently, we have been doing an audit, and up to recently have indicated that the turnaround time for permits are 3 to 5 days. So I need to look into your complaints regarding those 3 weeks, because that's not the information that I'm getting in on my reports.
Usually, as I said before, usually it is that we get it back in a timely manner. It's just recently I've been having that issue, and I'm not sure what is the maybe it is because of the payment issue, and maybe that information moving across has been the delay. I'm not quite sure.
Okay, so you still go online and apply for the permit, and it goes through? Is that what is happening now?
No,
you do the manual application.
Right, I do the manual application.
All right. The division was, if it's recently, the division is currently in undergoing ISO certification, ISO 9001 2015 certification, and we have had series of audits in the last couple of weeks. And so we have had to close down some of our services during that period of time. So the possibility existed that your processing of your permit probably would have been delayed over that period, but I don't know of it being 3 weeks. So I'm going to definitely have to engage Miss Smith. Have you spoken to Miss Smith about this concern as yet, or Miss Hayden?
Not as yet. I'm to follow up with some, because I submitted some new permits last week, so I'm to follow up with it this week to see if there were any changes. But I know for the previous set that I had submitted, it was delayed, but let me see what happens with this set, and then I can speak with her if I have any further issues.
All right. But I will follow through with that as well to find out where the permits are being held up. There must be a challenge somewhere. So I'll follow through with that to make sure that they move them out speedily. My apologies for that.
Ms. Graham, you're in the hot seat.
Understandable. Not putting you in the hot seat. Just want we're in such a dire need for medication.
Because we understand that the veterinary permits are critical, and the team. I think. May I ask you to do something for me? If you are submitting a permit application, and you would have gotten the products on permits prior, can you just attach a copy of the previous permit from me, please?
Okay.
That will
do that.
That will move it faster.
Excellent. No problem.
Dr. McLennan Miguel, I see your raised hand. Do you still have a question or a comment? See your hand raised. Dr. McLennan Miguel? No? All right. If there be no further questions, I believe it was Calithia who said that animals don't speak. But may I say, ma'am, that animals do speak to those who know how to listen. And coming out of these last 2.5 hours, We have moved from the private practitioner, the community pharmacist, who really is the person, that first person. The community pharmacist is the first person that communicates with the person in the community. That's a person that is going to be asked, my dog has an ear infection, or I have a cold, or my toe is hurting me, or I think I have sugar. And so the community pharmacist, such as somebody as Ramona, it's the first person, the first line of defense that we as John Public has to interface with. We then spoke with the regulators from the veterinary arm, and of course, all-encompassing Cynthia Lewis Graham, who spoke to us about our registration of our human and our veterinary pharmaceuticals and all the things that go into the use of veterinary pharmaceuticals and human medication. Mrs. Graham, you also spoke about how do we remove and mop up the illegal drugs. You briefly mentioned it, and it has to do with doing your inspections. The farm stores, I know, fall out. They're not a part of your remit currently, but I do know with the two big companies, Caribbean Broilers and Jamaica Broilers, they are moving assiduously to ensure that they control the veterinary pharmaceuticals that are within their remit. We have Calithia and Kurt Michael, we have Kevin, all K's, on this forum in relation to the veterinary side of things, who spoke to us about the good agricultural practices and managing the veterinary pharmaceuticals. And then Ramona, I think I realize you are at work because you are now masked, so I won't take up too much more of your time. Do you have any final last words? Any of our panelists? Mrs. Graham, I will forgive you because you were in the hot seat if you have no final last words, but let me speak with the community pharmacist so that she can go back to earning her keep. Ramona?
Well, the final thing I would say is, as you said, pharmacists are the first line of contact with patients, and it's really important that we as pharmacists ensure that we're disseminating the right information, that we are doing it for the benefit of the patients and not for monetary gain. And we're ensuring that we are basically just giving them the right information to treat their ailments. And as I said before, it's important to recommend non-drug therapies because we don't always need drugs or antibiotics. And it's important that we shift the mindsets and help us to realize that we can deal with our ailments in other ways.
I totally agree with you, Ramona. And this is where, as Dr. Kurt Michael spoke of earlier, the use of nutraceuticals and our yeast products. I got an unusual question last week about growing mushrooms and using mushrooms in the diets. I know mushrooms are used for other things as well, aphrodisiacs and drugs and so on. So I know more and more people are getting into alternative sources of medication. And I'm not sure. Yeah, I think Kurt Michael is still here. Kurt Michael and Calithia, could you just very quickly give us any famous last words in terms of your responsibility in the food production, food animal production, rather?
All right. Thank you, Dr. McNabb. Actually headed on the road. Yes, we have to be very careful as far as our treatment of these antibiotics or infective agents are concerned with a lot of our farmers. We know that some are experienced with the use of these products. And one of the big issues oftentimes that we see when we go on the road, all of us vets, is the mere fact that we have to agree with our community pharmacists that a lot of these persons really and truly are not doing best practices as far as raising the animals are concerned. and then it results in them having to want or desire the need for more and more antibiotics. So we have an awesome responsibility as practitioners who are out in the field to assist them to entreat them. Right? Sometimes it goes on boarding, on badding them out to do the thing the right way. But we have to do what we have to do for the preservation of the professions that we are in, and for the preservation even greater of the lives of persons and the animals that they have to interact with. Thank you.
I would like to add as well, veterinary pharmacy with that label is a little bit novel to Jamaica in a sense. I'm sure persons know of the idea of medication. Well, they know that medication is used for animals, but the idea of having a pharmacist that is dedicated to assist with the role of medication and how they affect animals and humans and all of that, it's not something that Jamaicans have really latched onto just yet. Sourcing medication has been an issue and still continues to be an issue. And until we can effectively impact that problem that we're having, we're just going to have to work a lot harder to ensure that all the stakeholders are involved to work together to address this whole issue of not only antimicrobial resistance, but medication use in animals on a whole. And this is something that we have to embark on as a team. All our vets have to be a part of it. Pharmacists have to be a part of it. The different regulatory bodies have to be a part of it. And everyone needs to work together. It can't be a disjointed affair. We have to definitely partner to ensure that we are sending out the same message across the board so persons will understand that, look, I can't go to the shop down the road and get what I want. I can only go to a specific place where I know that I can get the medication. The medication that I'm getting is safe. It's not coming out of India or China or behind some wall where we don't know what is in it. It is safe medication that we're using for animals, because in the end, it always comes back to us as humans. This is what we're consuming, and we want to ensure that what we're consuming is healthy for us in the long run.
Okay. To follow up on your note, I'm noticing Dr. McKenna McGill, she's also talking about not just the farm animals, but our small animal industry, the pet stores, veterinary, the small animal vet practices. It's important, well, that even though they use even smaller quantities than the food producing animal medicine practitioners. So for them also, apart from us, taking in a bottle or 2 or 3 or 5 in our makeup bags when we do travel, it's important that we do know what is in use here, because it really does affect all of us. One of our presenters, and I think it was Dr. Jose and yourself, Kalithia, who spoke about animal waste. Ramona spoke about it as well. Animal waste is also a source of veterinary pharmaceuticals getting into the whole cycle in terms of whether it be the eggshells or the waste matter. And so if there be no...
Before you close, Dr. Matnam, I just wanted to share some information with the team. So as we have been talking about natural health products, I just wanted to share the fact that the Food and Drugs Act is being amended for natural health products. And discussions were also leading towards veterinary natural health products, which therefore means that what we would want to do is to invite representatives from that division to sit with us as we look at building out that aspect for veterinary natural health products. So herbals, you name it. And then the other aspect of it too is that as we contemplate the first presenter made some very profound pronouncement in the sense that there are a lot of activities that are being planned and we're to look forward to. some of them including training in antimicrobial stewardship and so on. So we really want to be moving forward also with our antimicrobial policy document the draft was started some time ago. And we definitely need to look at it, put in place a steering committee, put in place what we need to do to get the political buy-in so that we can actually have that document and we can move forward. We are realizing over and over that the development of antimicrobials has been diminishing while the resistance is increasing. And so it is a very serious problem. And we're gonna have to just sit down and do a roadmap and take it seriously and move forward with what we need to do to contain antimicrobial resistance in Jamaica before we find ourselves in a very untidy situation. Over.
It's a very sobering thought because we have not had one new class of antibiotic in over 40 years. Somebody asked in the chat about augmentin and rosifin being used together. So we now have to be using multimodal. We have to be using, what's the term called when you use 1, 2, 3 drugs, just to get a particular medical effect. I thank you all. I'm sure I've gone into many people's lunch break. I'm home, so I'm okay. But for those of you who are at work, and if there be no further questions, synergy. Thank you, Karen Shaw. The term is synergy for using different pharmaceuticals get a particular effect. We have no new antibiotics. Everybody, thank you very much. Thank you for your attention. Dr. Walker has promised to send out your CE information.
Once they email me, so I know who requires it.
He has.
I'd like to thank PAHO for hosting this. Dr. McNabb, thank you for being my moderator as always, and all the presenters and all the persons involved here and behind the scenes. Thank you very much. It was a very productive session, and I hope we get some results out of it. I will take any other questions after and get it to the relevant persons because people are still firing questions, but we have actually run out of time. Back to you, Dr. McNabb, to end it.
Thank you, everybody. Have an awesome lunch, lunchtime. Thank you all, and see you again next year. Bye-bye. Bye-bye. Come. Oh, bye.